Germany, and at 37 and a half weeks, I go to a doctor's appointment and find out my blood pressure is high and I need to go to triage at McGee Hospital. Prior to pregnancy, I was diagnosed with high blood pressure, so I knew it was always a possibility. However, throughout my whole pregnancy, my blood pressure stayed very good. So I go over to triage where they monitor me, they have me relax, I lay down, they take my urine, and finally, after a couple hours, they send me home because my blood pressure is stable. So I go home, I go to bed for the night, I wake up the next morning, and I start to prepare for work. I received a phone call from my doctor's office telling me to get over to McGee Hospital. I was going to have a baby today. I said, I can't have a baby right now. I have to go to work. I have an important project that I'm working on that I have to finish. I need to be there. I will go to work and then I will make my way over to the hospital to have the baby, okay? She said, no, that's not okay. Absolutely not. Get over to the hospital right now. You're going to have a baby. So then I was just very anxious, scared. I hadn't had anything packed up to go to the hospital as of yet. So I just started to throw things together and get over to the hospital because the doctor sounded very serious about me being there to deliver this baby. So once I arrived at the hospital, I started to get all these machines hooked up to me and was told that throughout the labor that I was going to be getting a medication to help with my blood pressure. So the labor lasts hours, it seemed. And I just laid there. I was very uncomfortable, really couldn't get up. I had to lay in the bed. I did end up getting an epidural, which also caused me to have to just lay in the bed. But eventually, they came in and said, you're going to have a C-section because the baby's holding on to the umbilical cord and it's not coming down and the baby's stressed and we want to make sure that everything's okay. So they started preparing me for a C-section. However, a couple of times while they was preparing me, I kept telling my husband and my mom, I was like, could you please ask them to check me? Could you just ask them to check me? And they come in and out. They say, okay, we'll check you. Okay, we'll check you. They didn't check me. And then finally, I was like, really? Get someone to check me. So my mom finally said, could you please check my daughter? So they ended up checking me and they were like, oh my goodness, can you push? And I'm like, I'll try, as I'm numb from my neck down. So I pushed and I was able to get them out, even though I couldn't feel the push or the movement. So I was able to get them out and I delivered a healthy baby boy, 7 pounds, 8 ounces. And on my birthing plan, I wanted to do skin to skin. And I was determined to do skin to skin with this pregnancy. I've only had one other pregnancy. So I was told that I wasn't able to do skin to skin. I was very disappointed. I'm like, why? Because you have a drug that will make you loopy and we're afraid you may drop the baby. So this is where a doula will come into play. So if I had to tell a mother who had preeclampsia and she had to get this medication, make sure that you have a doula that can assist you in the process because you can have skin to skin by having the doula hold the baby up to you or your partner hold the baby up to you. So you will be able to experience that. Or your partner can do skin to skin as well. They didn't even offer that as an option. So, but just ask your doctors questions. Ask them to clarify things for you if you don't understand. Having preeclampsia is very serious. However, you want to be as educated as possible about it. I am supported after I've had the baby. I've been supported throughout the journey of having high blood pressure. However, at this time, I have had pretty normal numbers and have been able to come off medication. So I'm doing very well right now, and I have the support of my family members to help me out during all this process. So just make sure that you have support people around you and can help you. The nurses at McGee were great when they helped me as I was going through this whole ordeal. I feel like they were kind, they explained things, and they were attentive. So if you are dealing with this, please make sure that you have people around you who are going to be supportive and also ask as many questions as possible.